We're here in the beautiful park of Academy of Fine Arts in Zagreb on behalf of magazine SKICA, Academy Students Magazine, and Croatian Association of Expressive Art Therapies. And we're here with Dr. Avi Goren-Bar, educational and clinical psychologist and expressive art therapist from Israel. And we're here to talk about art therapy with him a bit and about the conference that is going to happen here in October in 2018. Okay, Avi, I shall start with a simple question, and that is, what is art therapy?
Wow. For me, art therapy is bringing inside the space between client and therapist any artistic media that will enable the client to express himself not only verbally but also through practically arts, movement and music. If you combine the three together, you get psychodrama or drama therapy.
So you're actually using art as a tool to arrive to the unconscious.
Well, you stepped 3 steps forward, but indeed, unlike the common approach of art therapy that enables the client to express his issues and problems that he wants to bring forward, my approach is to discover the secret, and the secret has to do with diving into the unconscious of the client, and the art is the vehicle or ascensor or elevator that goes down and brings unconscious contents into the conscious level.
So what would be the benefits of using art therapy in comparison to other types of therapies, and what would be its drawbacks?
Oh, that's interesting. You're speaking about the psychotherapeutic space. When you talk to me and I talk to you in verbal therapy, the dimension is dual. The art that is brought into the therapeutic space creates a diagonal where the art in itself, once activated, becomes autonomous figure in the dialogue, and therefore allows the client to relate to his art, the therapist to relate to the client's art, and we can both discuss the third. This is very deep. Having a third dimension in a dialogue will always bring additional database to the conversation.
So would you say that that kind of therapy is has more effect, is quicker? How does it differ from traditional verbal psychotherapy?
There is a complexity in your question, because once you proclaim that you are an expressive therapist, you are claiming that not only you know to deal with the media, the artistic media that you work with, but at the same time you claim that you know something about the human psyche. And this is an interdisciplinary domain that started like, I think, 50, 60 years ago, and requires from the expressive therapist to both be able to improvise on the modality that he works with, but at the same time to understand the human psyche.
So it is important to know the media itself.
You must be able to improvise at least on one domain, because once you improvise, you become spontaneous, and then the unconscious can burst out easily.
Then my next question would be, is it important for the people who go to art therapy to be familiar with the media themselves?
So here is another paradox. Absolutely not. Every human being is born creative. It's through culture that our parents and the educating system is inhibiting the person and restricts the person to be spontaneous. And by this, expressive art therapy is a rehabilitating space where you can connect to your true self. You don't need to do anything aesthetical necessarily. And as long as you express yourself by singing, dancing, moving and creating arts, you are starting to be acquainted with your true self.
So it is about the expression of true self. So art therapy serves as a kind of laboratory for change.
Well, once again, here you come to me. My interpretation of expressive art therapy is very masculine in the sense that I expect the process to be efficient. I expect that there will be before and a significant after, and therefore I expect that there will be change. But change, maybe this is your next question, doesn't come without suffering. And maybe you should read my books The Secrets of Expressive Art Therapy that has just been published in Amazon, the 2 volumes where I in detail explain how emotions create change. Expressive therapy is interested in evoking emotions, because when you are connected emotionally to an issue and not cognitively, you don't rationalize, and thereafter comes the change.
So we as artists and art students here at the Academy of Fine Arts, we are creating images and visuals.
Yeah.
From your point of view, what is the power of an image? Does an image have its own power?
This is a deep question that has to do with the psychology of the icon. From primitive time, even 50,000 years ago, we get graves and caves where you see images that the primal human being sketched, where the image contains in itself a condensed psychic database that the person holds for. For example, the cross. You see many women have a cross. This cross is an archetype of an image that holds in a condensed way spirituality, connectedness to past and human heritage, belief in monotheism, in a little sign. But at the same time, you cross a crossroad and there is a sign for entrance or not. So we are learning from early childhood to obey, to contain and preserve signs that have psychodynamic databases, and this is the power of the image. So, by the way, the image can also be while you're moving. In movement, when you close your eyes, immediately you will have an imaginary visual image, and then you do intermodality and you express it in art, and then you can negotiate the movement, all the same with the music.
Before we touch the question of intermodality, one more question about the images and the icons. How can you use the icon then in a therapeutic sense?
By give it a name. But you see, the client reports about a problem. Mm-hmm. You invite him through aesthetic distancing to do something in expressive arts, and then you have a ready-made something, which is the image. Mm-hmm. Up until now, you stay on the experience level. Now you have to zoom out and label the art as in a metaphoric way, like what is it for you? And then a sculpture becomes freedom, or a sculpture becomes rage, or a dance becomes connectedness. So you have to zoom out in order to have a cognitive understanding, otherwise there will not be an insight, and then we cannot turn it into a change.
Okay, thank you for that. And about the modalities.
So you're learning in this interview.
I'm learning, yeah. This is an educational interview.
Bravo.
You've touched the connection between then the icon, the image, and the body. Mm-hmm. In your clinical programs and in your clinical work, you use then intermodality. You use different modalities.
Yes.
How can they be used in correlation with one another?
First of all, differing art from movement and music is totally and simply politics. The human being, the baby, is born with what Daniel Stern calls amodal perception. Babies of 1-2 months can watch you singing and move their body. They can shout and cry, and you will attune your body to calm them down. So the primer first interaction on emotional base of human beings is intermodal. And for this you don't need to be an expert. People can dance, sing, and see images without needing to learn, and they move from one modality to another in a very natural way. And this is why I stand for expressive therapy and not restricting me and my students and my clients to only one modality.
Maybe to clarify things a bit, can you maybe give us an example of that? For example, there comes a patient with such issue, and how then do you, how does it look like to change from one modality to another? Can you maybe think of an
It
example?
starts with a short interview where my intention is to focus on a dilemma. You see, in this sense, I believe in short-term therapy, and this is where I interact with coaching. People are nowadays, we have to admit, are not ready to go on a 3-4 years of a quest, which is the possibility, but some people with strong egos want to deal with an issue. So I interview them about the problem of the issue, and then I invite them to express it in one modality. And let's say that the lady says, well, I feel it in my body. Then I help her to shape herself. I would introduce some music, archetypal music that has to do associatively to me with the problem, and there she starts a creation axis where she moves along the movement with contact, starting to organize herself in the space, improvising and arriving to the main theme, which is the dance. At the utmost of the dance, I will stop her and ask her to close her eyes and see an image. This image will be embodied in her body. Thereafter, we can go to the art materials, produce the sculpture or drawing, and again, once she did it and she did the whole process of creating the art, I would ask her to bring some 10 words in association, and we can create a poem. We can illustrate some melody to the poem, and we are circulating between movement and art and music and poetry, etc.
So we've touched on the question about modalities, but how about the theoretical principles that you base your clinical expressive therapy on? What is the theoretical background of it?
Well, I think I'm a Bloody Mary because I combine both creativity and knowledge in the arts.
Mm-hmm.
I finished Conservatorium, I have a bachelor degree in musicology, my PhD is in movement therapy, and I've been painting all my life, and at the same time a clinical psychologist, and I graduated all the conservative schools of learning Freud and object relations, Gestalt therapy, Jungian psychology. Each one of these I did profoundly, and I think in my case I could not stand on the one edge of the river. I do both. My theoretical background in psychology is embedded so much in expressive therapy until I started to develop my own original paradigm. For example, the creation axis, or for example, Jungian coaching, which is something that you don't find in academies, but it's a very practical tool.
Mm. And what would be specific about then your version of clinical expressive therapy? What is it?
I just
Goren-Bar has brought
explained
us.
my Goren-Bar. Okay. I'm trusting the process. I'm not afraid from the unknown. It's extremely important for me from the first moment I encounter with a client to create deep trust and loving relationship in the sense that I can accept perversion, deviation, difficulties. I'm not judgmental. I'm not afraid to confront. I'm not afraid to interpret. And I'm not afraid to be very creative as long as all this intervention will serve the client. I think it's a matter of personality that is coming across theory as long as it is on the expressive medias. This is my cocktail.
Okay. Here at the Academy, we do arts. Would you say that every kind of artistic creation, expression is therapeutic? Or there has to be something more to it for it to be therapy?
Yeah, this is interesting. It takes you back to the history of art therapy. It's all started in psychiatric hospitals where simply artists and dancers entered the walls of the closed hospital and enabled clients to express themselves openly on the art material, on the space, and playing music. Musicians came and entered. Eventually they discovered that this sublimation is doing something positive to the client. And this is the very beginning. Art in itself, on its own modalities, is not necessarily curing, but allowing a person to express his agony, his fears, his conflicts, his desires. How do you take this primer expressivity and turn it into a process has to do with the psychotherapeutic knowledge that we learned from Freud and others.
So then my next question would be, can artists become art therapists, or do you have to have psychological academical background?
You know, there is a system of dance therapy that is called Five Rhythm, and the establisher of this was a dancer that she broke her knee, total lost. She came to Fritz Perls to therapy, and she developed Five Rhythm. I think that an artist needs to have a basic break, either a trauma or handicapped, not to be able to touch the utmost of his artistic talents, and when he is wounded, he could become the best wounded healer. Yeah.
So you've now touched a deep Jungian concept, the concept of wounded healer.
Yeah, aren't we all wounded?
I guess we are.
Yeah.
Now maybe we can talk now a bit about your program here in Zagreb. You have a 2 years art therapy program here. Can you tell us something more about it?
You see, these 5 programs that I'm running in Israel, in Greece, in Turkey, in Croatia, and in Slovenia is merely a coincidence. This is a gift I got from God, and it happened like in 3 years. While coincidentally I was invited to make a workshop for the Adlerian Society in Greece, and my Greek girlfriend introduced me to a Zagreb SKICA girl, and who did her PhD in Freud University in Vienna. Thereafter I met Velimir Duganjic, who took the glove, and we started in Zagreb. There was Ellen Zapich, who was a coach, and he created Jungian coaching with me. And I met Andrea Anjour from Ljubljana. She said, we Slovenes, we need your approach, you are a brute. She brought me to Slovenia, and parallel to this I arrived to Turkey, substituted a friend of mine, and so on. I think that the Zagreb group is amazing. Here I compliment you guys because you are young, you are open-minded, very heart-giving. You learn fast. In this sense, you're very much like Israelis, and you're very devoted to the cause, and I'm grateful for that.
So what can people expect then when coming to your art therapy program?
This art therapy program is a certificate program. Better if you have prior knowledge in psychology or any behavioral science bachelor degree. Nevertheless, I've had wonderful students who came from architecture, from art, and even astrology. So you have to be a scholar, not to be afraid to learn. Nowadays, it's very easy to make up for psychological knowledge. There is a bachelor degree in every Google university, and you can make up for that. And all the rest is through the process. The program is very structured. It is built of 2 years, every 3 months, an intensive weekend, and it's structured so that we start with the creation axis. We go into Gestalt art therapy, we learn the Gestalt principles, and to apply them we dive into Jungian psychology, then we go into object relations, and in the second year it's a practical year. We learn how to do group art therapy, how to do family and couple art therapy, because a family is a small group, and then we learn diagnostics through art, and we finalize with a big festival, Who Are You as an Expressive Therapist. But this program doesn't end with absolute qualification. It's very essential that people go on with supervision. This is where they go on practicing and qualifying themselves furthermore.
So it's a lifelong process then?
Well, you know, I'm 65. I don't look like, because I'm learning all the time.
Okay. That's something that I shall look forward to as well. Here at the Academy, we're looking forward to the International Art Therapy Conference that is going to take place in October 2018. Can you maybe share something that is going to happen here?
And before that, I want to explain the idea behind this conference. In psychology and in medicine, there is an ugly tradition that the masters put down their disciples. And because I once kind of a brilliant student, I needed, when I started the programs, to enable my students to feel and say, yes, I can. To give a workshop is something that you need to take responsibility and enable yourself. So one of the purposes of these conferences is to enable our students to run workshops. And eventually, after 4 years, it's amazing because it's arriving to high standards, but it comes with modesty. Second, which is amazing in this conference, is that people from different countries speak the same language and become brothers and sisters. They cry together, they create together, they help each other. They don't necessarily need the verbal expressivity, but the tools and the verbal language, the professional language, is common to everybody. Zagreb is our last station in the cycle of 4 countries, and next year we will meet in Istanbul again, and it's an opportunity for people to express, learn, and create community, and this is very important.
And that actually is the title of our conference here in Zagreb.
Really?
Yes, Growing Together, Community as Art.
Growing Together, Community as Art. My spontaneous association for this, and I urge you to do, is to grab people in the street and expose to them the power of expressive therapy. We're sitting in this area. If in October it doesn't rain, then it's the perfect place. Come and enjoy. I will be there.
Avi, thank you very much for this conversation. And
Ivan, you know I love you. I admire you. You're a medical doctor and artist, and you will be a great therapist.
thank you.